Listen-only mode.
Hello, everybody. Thank you very much for joining us tonight. I'm very excited about this webinar. Dr. Alan Bauman, as you know, will be presenting what he knows and what he is able to share with us in a short webinar. So for those of you who don't know Dr. Bauman, he is a full-time board-certified hair transplant surgeon who's treated over 17,000 patients, and he's actually performed over 7,000 hair transplant procedures since starting his Bauman Medical hair loss practice in Boca, which he started in 1997. He's the founder and medical director at Bauman Medical. He's been featured in the world's leading media as a medical expert and successful early adopter of some of the most advanced technologies in the treatment of hair loss. I'm sure he'll tell you about some of those, including, of course, platelet rich plasma, my passion, and low-level laser light therapy, as well as FUE hair transplantation using both NeoGraft and ARTIS robotic hair transplant systems, and the CRLAB CNC 3D printed hair and scalp prosthetic from Italy. I can't wait to hear about that. He received his MD degree from New York Medical College. He completed his surgical residency training at Mount Sinai Medical Center and Beth Israel Medical Center in New York. He's only one of 100 physicians worldwide to achieve board certification from the esteemed American and International Board of Hair Restoration Surgery. He really does know what he's talking about. He's a fellow of the International Society of Hair Restoration Surgery. He's actively participates in lectures at numerous annual scientific meetings and live surgery workshops. He's the author of several textbook chapters on the science of hair care and hair transplantation. He also does eyelash transplantation surgery. So a lot to learn here tonight. So without further ado, I'm going to hand the microphone over to him. Of course, there will be a question and answer section at the end of the webinar. And also, I just wanted to mention that we record all of these webinars. We are posting them at the join.studioprp.com website under the webinar tab. You can see the ones that we've done previously. And we will also send out a link to the recording if you have to drop out early, or I'm imagining that you're going to want to watch it more than a couple of times. So you're on, Dr. Bauman. Thanks again for joining us.
Great. Well, hey, yeah, thanks so much, Dr. Roy. Really, I appreciate the invitation to collaborate with you on this project. I'm excited to be able to share what we've learned over the past number of years, really since 2008 in the field of hair restoration and doing PRP. And it's just exciting to be here with you guys, and I hope that you find it useful, interesting, and maybe it's something that you want to add or enhance in your practice if you're already doing PRP. So as we get started here, hopefully you all can see the advancing of the slides. This is just some legal mumbo jumbo that basically says that if you're really interested in using some of the information that I've presented here, that you should probably ask me, and before you do screen captures and incorporate this into any other presentation. Just would appreciate that. I've had, unfortunately, some issues this year with colleagues who are using a lot of our photos without my permission. So, of course, I'm sure all of you watching and doing this webinar with us tonight wouldn't do that. So just please ask if you want it. We're happy to share all this information as long as it's properly attributed. And we certainly collaborate with other physicians and other people from all over the world, other scientists, to learn about what we do, and we're happy to share it. But you shouldn't pass other stuff off as your own. So as Dr. Roy mentioned, I'm the founder and medical director of Bauman Medical Group, located in Boca Raton since 1997. It's been my life's work and my life's passion to treat patients with hair loss. If you're in town in South Florida, you should stop by our 11,000 square foot facility. And our mission always is to improve the appearance and well-being of our patients through optimum hair health and restoration, of course. And there are many different aspects of the practice, which I can explain at a later date, but basically it encompasses medical, research. We also have a consulting division, a trichology division, and of course what you're participating in tonight is part of our educational arm. So tonight, we'll go through a little bit about who I am and just elaborate a little bit on my background and bio. Go into hair loss and hair restoration, really the problems that exist out there. We'll talk a quick bit about hair follicle physiology, go into PRP basic science and how we use PRP in hair restoration today, day in and day out, really in our practice, and talk just quickly about some practical considerations and give you some ideas on how you can expand your knowledge in PRP and hair loss. It's certainly an exciting time in the field of hair loss, and especially with the advent of PRP. There's so much more data now, so much more information than we had just a few years ago in the clinical literature. So it's exciting to bring some of that stuff to you. Dr. Roy mentioned my training and my accolades. Obviously, you can reference that later on if you'd like. She also mentioned that we do treat about 1,000 patients per year, and through our hair loss protocols, we try to diagnose and medically treat these patients. We track their hair loss and their hair regrowth scientifically through measurement tools that were actually not even available when I started my training 20 years ago. And a lot of what we do in the practice is not just hair transplantation, but it's this medical management and the compliance protocols. So we'll touch on that at the end of the PRP lecture today. And of course, our commitment to education. So what's the story with hair? Why is it so important to us? I guess evolutionarily, hair was designed to make us look good and feel good. That's what it means to look in the mirror and have a youthful and healthy head of hair. And in society today, most people want this beauty and youth and vision of health. And a good, healthy head of hair exemplifies all of those things. But when hair loss occurs, some other things can happen. So here's a very busy slide, so I apologize for that. It's actually like an infogram that tells you a little bit about the hair loss statistics, and it's staggering that there are maybe nearly almost 100 million Americans out there who are suffering from hair loss. So 40 million men, about 4 in 7 are going to get it, and about women are going to have some thinning hair. And it could mean, you know, a bad hair day could turn into a bad hair life if hair loss is occurring. And certainly we should not underestimate a psychosocial impact of hereditary hair loss. These are things that have been well studied and well documented in the literature. Shame, anger, embarrassment, and such, sadness and depression, frustration by those who are experiencing hair loss is not uncommon. And it's something that we see every single day in the office. I'll tell you, you know, probably not a day goes by here at Bauman Medical where we don't have a male or female patient come in who is in significant distress about their hair loss situation. So it really requires a lot of compassion. You know, sometimes when we're dealing, especially female hair loss, you know, the patient's crying, we're crying, my nurses are crying, everybody's crying, but we're getting through it, and we're getting to the meat of the matter, and we're treating the situation. And on the other end, obviously, there's smiles and happiness. But when hair loss occurs, it can be a bad situation. And we do see hair loss in many different patient populations. I treat even toddlers who have had injuries, who have hair loss from scarring or surgeries, and then teenagers who are terribly you know, overstyling their hair, and of course the other alopecias that we see commonly, as well as androgenetic alopecia, which makes up the bulk of the practice. But we also treat alopecia areata and totalis and offered some options for them as well. So as we get into my favorite organ, obviously the hair follicle, it's a pretty amazing little bit of business there. It's sitting under your skin, and you know, I would call it a very, very highly accessible dermal appendage, which is muscular, neurovascular, endocrine mini organ that contains a stem cell niche capable of degeneration, regeneration, and obviously can generate a pretty significant emotional response if things are going in a good way, or unfortunately if there's hair loss, maybe in a bad way. But there's about 100 to 150,000 of these follicles on your scalp. About 9 out of 10 of them are producing hair at any given time, and they're producing at a rate of about a ½ an inch a month. So that's about 1,600 inches a day total over the top of a healthy head of scalp. And so that's 138 feet of hair per day there. I'm sorry, 1,600 inches per day and 138 feet of hair just from your scalp alone. And that doesn't take into account the 5 million body hair follicles that you have. As we move along, there a lot of research has been done on the neurovascular part of the hair follicle, and today, of course, even the stem cell areas within the hair follicle itself. To the lower left here, you see the vasculature that surrounds the bottom of the follicle. So anything that impacts blood flow is going to be very, very helpful to us. And on the upper right, you see the multicolored image there that is highlighting not only the bulge, which is the stem cell location within the hair follicle, but also the neurovascular bundles that are in that zone. It's important to know that hair follicles cycle on and cycle off. As I mentioned, 9 out of 10 are in a growing phase. The others are in a resting phase. And so we've all heard of anagen, catagen, and telogen, the parts of the hair cycle. The hairs are ejected from the scalp, somewhere between telogen and anagen, of course. As the new hair is produced, it can push out the old one. But problems with anagen and catagen and telogen can result in significant shedding. And also, even treatments that stimulate anagen can also exacerbate a shedding condition in the short term. So this is a very important thing to know, and a lot of patients do come in with their little Ziploc baggie of the hair that's fallen out, and of course that's always a major concern. The orchestration of the hair follicle cycling is a unique process that happens in communication between the bulge, the stem cell area within the bulge, which is just below the erector pili muscle there near the sebaceous gland, and the dermal papilla, which is really the proliferating area of the hair follicle that really makes the hair fiber. So there's a lot of communication, intricate communication between these two areas as the hair follicle cycles on and cycles off through anagen, catagen, and telogen. And to even get more complicated, many scientists are looking at the entire stem cell niche of the hair follicle, which talks about the interactions between the local cells, not just the follicle, but this would include also cells within the dermis. The dermal fibroblasts have a role in regulating these on and off cycles, as well as the adipocytes. And I think this will be very important in understanding maybe potentially how PRP really works to stimulate hair growth in the scalp, and maybe some future treatments as well. So I know this is a busy slide. It's not designed to be an eye test, but I wanted to just give you an idea of some of the growth factors that have already been identified in the hair follicle as regulating some of these on and off cycling issues within the stem cell areas and the communication that goes on. Just pay particular attention to a few of them, like VEGF and EGF, pardon me, interleukin and other cytokines and such. You're going to hear and see these again and again in the literature, and I don't want to steal some of the thunder, but these are also some of the growth factors that we'll find in our platelet-rich plasma, in the alpha granules, in the platelets. So when female pattern hair loss occurs, actually it kind of sneaks up on women. You know, this standard Ludwig-Savin scale that you see in every hair textbook, and it goes from 1 to 3. But unfortunately, by the time hair loss is visible to the naked eye and you get to stage 2, you've already lost 50% of your hair. So this is really not a great diagnostic tool, unfortunately. But the good news is that we have the abilities to do some measurements and evaluations before we get to the end of stage 1 here, where it still looks like you have coverage. So a number of different factors can affect hair loss in women: medications, illness, their overall health and diet, stress levels, cortisol levels can affect the hair follicles, as well as hormones and surgery. Certainly, heredity is the main factor. But even things like jet lag and sleep-wake cycle disorders, not even night float in nurses and such, can cause some pretty severe disruption of these cyclical organs that we see on the scalp. And so when hair loss occurs in women, it's not typical baldness if it's a hereditary issue. We see a widening part line, a little bit of loss of coverage. It may or may not recede the temple areas, but certainly result in a loss of volume and certainly some excessive shedding. Now in men, the hair loss is visible from across the room. We can see that it starts with a receding hairline and a balding spot in the crown, and sometimes progresses to total hair loss over the course of the scalp. The idea is to try to target the process when you have some hair follicles left in that zone before it's totally dead and gone. Obviously, if the follicles are dead and gone, we have to transplant. So we want to take action early. Pardon me. We know that male pattern hair loss is a result of a breakdown product of testosterone into DHT, dihydrotestosterone, which is the main trigger for the miniaturization that occurs in the hair follicle. And so in the scalp of someone, you have a progressively smaller, thinner, and less pigmented hair that's growing from those follicles over time. They're going to spend more time resting, not as much time growing. You know, in our office, we call this follicular homicide. Now, in the lower right-hand corner here, I just found a picture of my dad back when I was a boy, and he's on the right, obviously, there. He had some thinning hair back in 1976, and by a couple decades later, he had lost all his hair. So it is a progressive condition. Obviously, we can see that just within the span of 20 years. He lost all of his hair. And actually, the other reason I put him in the slideshows, because one of the reasons why I got into the field of hair loss and hair restoration. And I did restore a full head of hair for my dad, and if you've been to the website, you've probably seen that. As we move along, looking at the scalp under the microscope is something that we do every day for every patient. in multiple areas, comparing the good areas under high magnification to the areas that are experiencing some thinning. And this is a good example of what we do with the hair cam. It's an iPhone appendage that we use daily. And you see on the left good quality hair follicles growing good quality hair fibers. And those fibers are thick and they're dark, and there's a high density of them there. And you can see at the lower magnification, it's producing quite a bit of coverage there. And as we go to the right, there's miniaturizing hairs. And what that means is that you're seeing that thinner, weaker, wispier hair, and obviously resulting in probably a big lack of coverage in this particular patient. I put up this one in particular because I like to show the patient that if there are some hair follicles there that we can maybe rescue and enhance with medical therapies. And we do use PRP as a part of a multi-therapy approach in many cases, as well as a standalone treatment as well. But if you can target those follicles before they're really dead and gone, then that's when you're really going to have a chance to make a nice improvement for the patient. So this is going to help you with patient selection and also help you kind of determine before you address an area with PRP which area is likely to have the best result. And you want to look for that highly miniaturized area where there's still some hair left and it's not totally dead and gone. So what are the treatment strategies here that we use in the practice? We want to reduce medical factors for sure. Of course, we're taking a holistic approach. So if there's medical conditions that are causing the situation, medications like blood pressure pills, cholesterol medications, mood modulators, those are terrible. Stress levels, and of course the scalp health is a critical step now. We want to reduce any kind of inflammation of the scalp to try to grow good hair. As I mentioned, androgens are a big factor in men. It's a primary trigger in men. And some women actually are androgen sensitive, and we have ways to figure that out with genetic testing these days. So there's pharmaceutical ways that we can reduce those androgen effects and nutraceutical ways. We want to definitely try to stimulate or enhance those functioning of the follicles. And so this is where we can use the pharmaceutical therapies like topical medications and nutraceuticals, as well as cell therapy like PRP, and of course low-level laser therapy. I'm a big advocate of light therapy for the scalp. And and of course hair transplantation. So actually the two patients on the right-hand side on the top, both were treated non-invasively. Top patient used a combination of topicals and laser. The second patient, just laser therapy. Bottom two were hair transplants. But getting into our business tonight of plasma, really in the old days, I would say like 2008, it was old days for the hair doctors. Already orthopedic surgeons have been doing PRP for maybe the better part of 10 years, and dentists as well. So the hair doctors are kind of late to the game on this program, but we're trying to play catch up really quick. What we saw is that there were a lot of, and today there's a lot of fields of medicine that can benefit from PRP. Everybody from cosmetic surgery to urology and sexual medicine, dermatology, of course. And PRP is great for wound healing, and that's really one of the things that got us started in using PRP. Was some of the word on the street from our fellow physicians in hair transplants that they were getting better growth and faster healing from using PRP along with their hair transplants. And it was Dr. Cooley and a few others, Dr. Wiebel, in South America, and many others who really kind of pushed it forward and got me thinking about it in the early stages, in the late 2000s. Put in a nice picture here. You've got your foreign blood components. The red blood cell, obviously easy to identify, white blood cell, and a platelet, and their relative sizes. Now, of course, they weigh differently, and that's why when you centrifuge them, or even just stand a test tube in the fridge overnight, it'll settle out, and you'll get a separation of them based on their size, thanks to gravity. Platelets, if you're just tuning in, are not just for clotting anymore, actually. They actually regulate quite a bit of tissue repair and regeneration. And so we can see here that platelets start out kind of in a circular discoid shape, and then as they get activated, they send out these fibrils and such to help the clotting process. But they also release quite a bit of cytokines and growth factors and such. And these are the messages to the local area that kind of orchestrate and recruit stem cells, mobilize stem cells, and initiate things like tissue generation and repair, and of course new blood vessel formation as well, which we'll get into in a moment. So just a brief interlude. You can take a look at some really cool pictures of platelets that I found. These are all activated platelets. Most of these are real pictures. The ones on the bottom left are computer generated. So back into our business here. platelet growth factor functions have been very well studied in the literature. It's easy to see what growth factors are within the platelets, such as a platelet-derived growth factor, obviously the name, TGF and VEGF, EGF, and fibroblast growth factor and IGF. These are all locked away inside those granules in the platelets, and they have a very, very strong effect in the area where they are released. And you can see the biologic functions from endothelium, fibroblast mitogenesis, to collagen synthesis, to proliferation of other cells, and angiogenesis, and vessel permeability, and so forth. So these are very, very powerful molecules that we are trying to harness for the betterment of our patients. So how do we do that? Of course, there's a spin that's involved, and most of us are looking at trying to get a very high concentration of platelets. We want to try to get more than 1 million platelets per microliter in our platelet count, and we'll go into some of that information in a little bit. We have here a picture of the whole blood. That's what regular blood looks like, and when you spin it down, obviously you're going to see a lot more platelets there in the platelet concentrate. So as I mentioned, the platelets are storehouses for regulatory signaling and growth factor molecules that enhance hair growth. So this can be used as a standalone therapy. I'm going to get into the reasons why this is the fact, why we think this is working. This is a really, really cool diagram that gives us a little bit of insight as to exactly what's happening with these growth factors that exist in the PRP and how they might affect a hair follicle and the folliculogenesis, if you will, or the cycling of the hair follicles. How would they impact it? So when the growth factors bind to this tyrosine kinase receptor, for example, you get a cascade of events. And this cascade of events will increase proliferation and differentiation and survival of certain cells and decrease cell death in other cells. And so I've listed here on the right-hand side, so when you go back, you can see what each of the different growth factors and triggers are here, as well as the description, which we can reference later on. Platelet concentration and stem cell proliferation, there's a relationship, right? So we want to, it would make sense, we want to try to concentrate these platelets and concentrate the growth factors to get the most amount of effect as possible, right? So someone did a study to find out, hey, what does this concentration do to stem cell migration and proliferation? And yes, absolutely, it was related to the concentrate above native levels of in the blood serum. And so as you increase, you get more stem cell migration and more proliferation, and that would be one of the reasons why you get better wound healing, decreased shedding and increased hair growth, perhaps, as stem cells rush into the area potentially. But is more always going to be better? And so another study looked at the amount of vascular neogenesis in relation to the platelet concentrates that were applied, and what they found was a biphasic curve, meaning that as you reach a certain maximum concentration, then you get the maximum effect. But if you go over that, then you start to get a reduced effect. So they found that there was an optimal concentration of about 1.5 million platelets per microliter to get this vascular neogenesis going. So if you're not getting a 4 to 6 times concentrate in your PRP in the injectable product, you're probably not reaching this threshold, or the other one for stem cell migration. So there's ways that we in Bauman Medical, we test all of our PRP and the whole blood for every patient that we do, as well as actually the PPP, the platelet poor plasma that we pull off. So we know exactly what our PRP treatment is actually giving to the patient. So cool thing about PRP for hair loss is that it's the patient's own blood. It's obviously going to contain these growth factors that we've mentioned. You can do it right at the bedside. Patients walk in, walk out. It takes about an hour in our office because of some of the things that we do. Give or take a little bit. So we call it a lunch hour vampire treatment, if you will. It's relatively comfortable. If you use local anesthetic, the patient should feel nothing, and it is relatively low risk. So what do we do in the office? How do we get this job done? Obviously, we want to select a good patient for this, and I mentioned a little bit before, we're going to look for someone who has some miniaturization, see what's going on in those areas of the scalp, get an idea of what their concerns are, address the risks and other factors, discuss other alternative therapies as well as PRP. We're going to take measurements, and we're going to do some photography. We're going to look at the scalp, not only under the microscope, but also with standardized photos. We're going to perform the phlebotomy carefully so that we don't hemolyze the blood. We go to spin. And we're going to centrifuge and concentrate that blood with the, we use the M-Site PRP kit to concentrate it. We find that that gives us that 4 to 6 times concentrate. We'll do that testing I mentioned. We can additionally add some enhancements, and we'll talk briefly about this in a future slide, that sometimes we will add placental tissue to the PRP before injection. In the past, we used A-cell. Some patients do request that as well. You could light up the PRP with a multi-wavelength light to try to stimulate more cytokine production. So there's a number of different things that you can do to enhance the effects of PRP, in my opinion. We will always do antiseptic and anesthetic block of the patient's scalp. And I think this is important to be able to get the PRP in the right place in the scalp. So then we'll proceed with a very superficial intradermal injection of the PRP, do the microtrauma and microneedling after. Some physicians that I've talked to like to perform the microneedling before. My preference is to do it after. And then the patient will be given some post-treatment instructions and their follow-up appointments. If you're interested in the entire detailed part of the protocol, then I encourage you to go to this link, which is hai.rs/PRP hair training, and register there, and you'll get some more information about our particular protocol, and even some opportunities hands-on to actually watch it being done if you like. So as I mentioned before, we always in our practice measure what's in our PRP because we want to know what is that concentration factor, how much PRP concentrate are we getting over that whole blood, and what is our total concentration of platelets or per microliter, actually. And so this is this is the machine I actually have in my office. I took this picture this week to add it to the slideshow. And this was a patient that we did last week, just randomly took one of the first ones I saw in the book. And you can see her whole blood initially was just under 200, and her platelet concentrate, once we were done with the processing, was about 1,200. So what that means is that we had about 1.2 million platelets per microliter in about 7 cc's of our injectable. And we do this kind of log and testing with the hematology analysis machine, like I said, for every patient. And this becomes part of the patient record. So we have a pretty extensive record of all the PRPs that we've done thus far this year with the counter and all of the platelet concentrates. So we'll be able to correlate that, hopefully, with the hair growth that we're measuring with, like, for example, the hair check. Which brings me to this slide. The hair check is an amazing tool. If you haven't gotten one, you need one. If you haven't learned how to use it, or you forgot how to use it, you've got to come to the training to learn how to do this. This is a 5-minute thing that basically tells you and the patient how well your treatments are working. And whether you're telling them to stand on their head doing a yoga pose at night, or prescribing them a topical medication, or performing PRP, patients are going to want to know how well it's working and where and how much. And the hair check tells you that in about a New York minute. And so this is an example of some of the hair mass index tracking that we do over here on the left-hand side, and you can see our baseline numbers here for this patient. And as the hair mass increase over time with treatment, you can see there's a peak and a plateau, and then it starts to diminish. And of course, over time, this is a common type of evaluation and measurements that we do to really track exactly what's going on. Remember that hair growth is only about a half an inch a month, so it's going to take you about 90 days to start to measure this, and it's going to take you 6 months to see a change in the mirror for just about every patient, and maybe even a year to see a full improvement. So measurements are going to be performed at routine intervals to determine when your next PRP treatment is done. And it's very important to tell the patient, obviously, that this is not a permanent result, but that they're going to get some kind of plateau, peak and plateau, and then a diminishment of the process, of the result of the process over time. And so they need to be ready for measurements and determine when their next PRP will be. The way that we're doing our PRP with the additional enhancements like a BioD, which is the placental extract, we're getting about a year's worth of improvement from each patient, which is kind of nice. Instead of having to bring them back in every other month for treatment, doing a standard PRP, we seem to be getting a little bit more oomph out of the PRP with the addition of the amniotic and placental-derived extracellular matrix. So that's a little bit beyond the scope of this lecture to discuss the benefits of A-cell, which is a tissue-regenerating technology made from pork bladder. The Adilite is something else that we also like, and of course low-level laser therapy before and after their procedures. I think they're very, very important. And so there's a reference here that you can take a look at. Again, if you want more information about these enhancements, I encourage you to seek out additional education on this topic. So some of the histological PRP effects that are seen within the scalp, this is all within the literature now. You can see epidermal proliferation. These are done on biopsies. Stimulating the growth of follicular bulge stem cells and folliculogenesis. We see increased angiogenesis, more blood vessels obviously seen not only histologically and otherwise. We see increased numbers of hair follicles, so If a follicle was there but wasn't producing a hair, then there's a good chance that PRP is going to kick it into action, start that anagen phase, increase collagen, increase fibroblasts, and so forth. And probably most importantly, increasing the thickness of the hair shaft that's coming out of the scalp. I have to give a shout out to Dr. Buhana because he influenced me a lot. Probably in 2010, I watched his lecture on PRP in Paris at a Masters in Hair Transplantation conference, and the light bulb went on for me because he showed the increase in the hair density and also how long this effect was going to last on his patients. He showed some nice before and after. So shout out to Dr. Buhana out there. Some of our results with PRP. Patients always come in and they say, I don't see a lot of results on the internet. And really this is because you don't see a whole lot of results on Rogaine on the internet either. And the issue is that because once a hair follicle is dead and gone, or you've lost enough hair to see the scalp shining through, think about that quantity of hair follicles that are already dead and gone. It's astounding. So really, the patients that you're going to see with good results visually in the mirror from PRP are the ones who've just started to lose a bit of coverage. So this guy has been cherry-picked for this slide presentation because you can see that he's a pretty young guy, but he's just on the verge of losing some coverage. So his result from PRP measurably may not be that much different than everybody else. Let's just say a 10 to 20% improvement in the area, but it was enough to give him a huge increase in coverage because he had a huge number of hair follicles that could be regenerated. And here you see the before and afters in 9 months. And he was a real happy camper with the treatments that we provided. I mean, it basically saved him from doing any other therapies at the moment. So he's pretty happy about that. Women can sometimes have a very devastating condition. This is a patient who had a severe amount of hair loss before we treated her. She had a nice improvement, not necessarily in that frontal zone where the devastation had really already occurred, that follicular homicide, if you will, but actually around the frame where she had a little bit more hair density. That's where she got a big improvement in bulk. And so she was sensitive about pictures of her scalp, and she will put on that second picture. But if you look down in the temple areas, that's where improvement in hair quality and quantity really occurred. And I will make mention that we also use PRP for small areas of alopecia areata. We've had some pretty good success. It takes about 12 weeks to see the response in most of these patients. There's another patient with alopecia areata who had some change coming on at 6 weeks and then resolution at 12 weeks. So kind of exciting. This is a more typical patient that we see. Great candidate for PRP. Starting to get a widening part line, a lot of scalp shining through in the PRP for her in that area. It's not a complete cure of the situation for sure, but definitely a nice improvement at that 9-month timeline, which is really, really great. We've had some interesting success getting the word out on the street about PRP for hair regrowth. There's been a number of news stories, not only in the local and the national media, about PRP. A lot of people here in South Florida have had PRP already done on their knees or joints or otherwise, so they're very much in tune with how good PRP works in other areas of the body. So it's just kind of a natural thing. I will make mention also of how we use PRP in hair transplantation. It's part of our history. As I mentioned before, Dr. Weeble, Dr. Cooley, and some others in the field were using it as not only as a graft storage media, but also as a wound healing accelerator during hair transplantation. And again, it was Dr. Buhana kind of convinced me that, hey, this could really work as a standalone treatment. So just to conclude out tonight, hair loss is certainly a concerning problem for many. PRP offers a promising treatment option as a non-chemical, minimally or non-invasive treatment. Risk is low and side effects are very rare. And we could go over some of the side effects in future educational opportunities. I think it's important, the take-home message, to realize that not all PRP is created equal. That certain differences in platelet concentrates and other factors are going to be very, very important. And maybe Dr. Roy can give her input on this as well as we finish off here. But the preparation, dosage, and the administration and such can vary greatly, even amongst different preparation styles within your own office with the same equipment. So a couple of years ago, the research on PRP hair regrowth was almost non-existent, but now the evidence is increasing. So keep a close eye on the literature. You're going to see more and more coming out because these protocols are working and they're constantly being improved by people out there. So if you'd like to learn a little bit more about PRP, For hair regrowth, we do offer hands-on training programs at Bauman Medical Group. It's an exciting and fun educational opportunity to take part in. We also teach the medical management of hair loss at the same time, in addition to the hair check measurements, of course, which are the compliance protocols. And we have a pretty interesting program for those who are trying to add PRP to their practice or enhance the PRP that they're already doing in their practice for hair loss. And to learn a little bit more about that, I would just say go to the bit.ly link that you see there, hai.rs/PRP hair training, and register there if you'd like to get a little bit more information about some of the things that we have to offer you, and we would love to share those things with you. So my motto is, what's good for your patients is good for your practice. If you're already doing PRP, keep doing it. You're only probably going to get better at it. So keep at it. The references are listed here in the presentation, so if anybody would like a hard copy of that, also go and register at that link. And we are also in the handout section of the GoToWebinar, you will see there's also a printable registration form. In the handout section, we've got the Bauman medical training there listed there, as well as some other information as you need. So I really do thank you for your attention tonight. I hope you found it interesting and maybe picked up a pearl or two as we went through. I know we went through quite a good pace, but the idea is to give you a little bit of an overview of what we're doing and how we're doing it, and how excited we are about what's happening in the field of hair restoration. We hope we can help you take it further.
Dr. Bauman, thank you very much. Here I am. Thank you very much. I really appreciate it. I do have a couple of questions, and there were a couple of questions that came through. First, I was very impressed, actually, by the CBC with differential that you do on all your patients. I wish we could all do that. I think that data collection is going to be very valuable in the future. For my procedures, I definitely need a robust platelet concentration, but I'm also very focused on the monocyte and granulocyte levels, where the granulocytes are pro-inflammatory and the monocytes are anti-inflammatory. And looking at your strip there that showed the differential, there was very high monocyte count and very low granulocyte count. So when I use Platelet Rich Plasma, and some of the urologists that I've spoken with who use Platelet Rich Plasma, that's a very important piece for us. How do you feel about that and its importance?
Absolutely. Yeah, and I would 100% agree with you. I did kind of slide through that pretty quick on that slide, but yes, getting rid of the granulocytes are definitely inflammatory, as well as the erythrocytes, of course. Some of our earlier kits and spinners were giving us platelet-rich plasma that I would consider tainted, literally, bloody, with erythrocytes, and it created a lot of inflammation on the scalp, and even discomfort, and in some cases bruising. And for scalp treatment, we definitely want to avoid that. As I mentioned, if there is an inflammatory process that's visible to the naked eye, obviously we want to take care of that. But we do know that even male and female pattern hair loss has an inflammatory component to it. I did some research a couple of years back with collaborating with the University of Miami and inflammasome research on the caspase release rates and such, and we know that there are certainly inflammatory markers that are happening even with male and female pattern hair loss. And it's one of the reasons why we put anti-inflammatories in many of our topicals. And I think that you're absolutely right. Getting that monocyte count up and the granulocytes down is also an added benefit to the hair loss process, meaning you're going to get better hair regrowth if we can get that inflammation modulated down.
Yeah, well, that's good.
Yeah, good point. And a lot of the single spin processes really don't help you do that.
In fact,
what's been your experience in that?
It's my understanding that M-Site really is the only system that's out there that does effectively give you a high monocyte count and a low granulocyte. Actually, that's not true. I'm sorry, I'm going to correct myself. One of the Arthrex systems does affect that ratio favorably. It's not quite as robust as M-Site, but just to be fair, there are very few systems out there that do. And we're all focused on platelet count, which I think we absolutely need to be true to the science. But I just want to raise that with monocyte and granulocyte because it often just gets skipped over. And I think it might actually be more important than we realize. We are going to have Dr. Peter Everts on one of our webinars coming up soon. He is the most published scientist on platelet rich plasma, and we'll have him share all of these little details with us so that we can get the best outcome. I think it is those details that are going to prove better outcomes, as we learn more and more. So thank you very much. One of the questions that came in earlier was about a favorite microneedling device, if there is a favorite microneedling device for you, and also asking the question about the EndyMed Intensive device. Well, I actually have that device, and it's a radiofrequency microneedling device. I wouldn't use that on the hair right now. I would worry about the potential inflammation that occurs as a result of the radiofrequency, which is excellent for collagen stimulation, but I'm not so sure about hair follicle. What are your thoughts on that, Dr. Bauman?
Well, I wouldn't use it on the scalp, the EndyMed, but in terms of my favorite microneedling tool, there's a lot of discussion out there about what microneedling tool is going to be FDA approved or not, and so forth. And we all know that these devices are, I would say, just at the moment in limbo.
Yeah.
There's I will tell you my preferences in terms of microneedling. I do it very lightly.
Yeah.
You're not going to, I don't try to make a hamburger out of the out of the scalp there. We're not doing a resurfacing job. We just want to activate the platelets and let them know, hey, there's a little something going on here. So I'm looking for a little bit of punctate bleeding, a little bit of erythema. I find that the powered tools, not battery, but actually the AC powered tools work a little bit better in the scalp. They don't seem to catch on the hair. And certainly, definitely want to try to avoid any rollers, which get tangled in the hair, and that can be a big mess.
Right.
So there's a billion of those devices that are out there. But hopefully, we'll have some interesting news for you within the next 6 months or so about some companies that are working on, the approvals and the clearances that they need to really be able to take these tools to market appropriately.
Yeah, that's a very good point. And for any of you who aren't aware, the FDA is not happy about many of the medical devices that are being offered that many of us have actually in our office. And I don't necessarily think it's a problem with the device itself. It's more going through the approval and making sure that these needles are sterilized and things are done properly. PRP Science does offer the DermaPen 3. That is what I use. I agree. I like a cord, a pen with the cord versus the battery. I think you get just a much better consistent delivery. And I think that's probably enough we need to say about that. The other question says, I just started doing PRP hair growth treatments where I mix vitamin D, B complex, A cell together, and I inject it under the scalp. Over that, I also inject activated PRP. After that, I do microneedling with leftover activated PRP. This is really getting into some of the protocol stuff, which I think it should be left for the training, because there's so much to this and so much knowledge that we really should have about hair in general before we go off and just start offering these treatments. I'm not a proponent of offering platelet-rich plasma as a solution, as a solo treatment, without any further knowledge about medical options and maybe doing blood work looking at hormones. So I'm actually not going to finish that question. If I hope you don't mind, Dr. Bauman. But I really...
Yeah, no, that's fine, and I agree with you. And, you've been through the class a little while back. Things have changed a little bit, but, so you could probably speak to how, important it is to go through that kind of a specialized training program.
It really is. In our last webinar, we did an hour of that point exactly and what training programs are available. And I just briefly mentioned yours. I will say that it is excellent. I went through it. I learned a lot. I actually feel as though I need to go through it again, because I think there's a lot more that I need to pick up and incorporate into the practice. I always check different nutrient hormone levels. I do quite a bit of medical management, and that's all thanks to the knowledge that I picked up, or the information rather that I picked up at your training. It's excellent. I love the hair check. I don't do enough of them. I'm really rather embarrassed to say that, but I think that whenever you can get an objective measurement of
because
success.
I'll tell you that there's, I mean, if you just over-the-counter minoxidil, minoxidil and Rogaine has been rated as the worst hair growth treatment ever by Consumer Reports. Most disappointing, and probably the reason is because most people give up too soon. They don't see the results of the treatment because they only bought 2 bottles worth. They used it for 2 months. And
Right.
for even to get a minimal amount of visual improvement, you have to really have a close-up magnifying mirror in your bathroom and be looking at 3 months, not 2 months. So the hair check eliminates all of that. You don't want a patient coming back in saying, hey, I don't know if this really worked, and we don't need that kind of word on the street. Not about PRP. PRP works great. So do the other therapies. And in order to have patients understand it, they need to know it takes time for the hairs to grow, and you're going to measure it before you are going to see it. And so that's where the hair check comes in. It's critical.
Yeah, I think that's important. And patient selection is a key. Right. Right. And patient selection is the key. Setting the right expectation is the key. Helping patients understand that, platelet rich plasma is a tool. It's not a magic wand for anything that we do, although sometimes it does feel like that. You get an outlier who just has an amazing, robust response no matter what you're doing. But really, it's a tool, and it's a great tool. And when we use it in conjunction with science and medical management and setting the right expectations, it's excellent. Also, one of the reasons why I need to get back to your training and bring one of my staff members with me to learn how to do hair checks is because it's good for business. And that's the other thing. If you get somebody who walks into your office and who is willing to pay for a procedure, it costs a lot of money to get that patient through the door. As we all know, we're business people as well as physicians. It's very, very important that you serve them well and that you continue to have them come back to you for the things that they need. So that hair check is a great tool to get them back in 3 months. They're excited to see what the results are. They're willing to continue care. But, we all get busy, and before you know it, 3 months is 6 months. And you're right. They just, this isn't working. They don't have the objective measure, and they don't have that coaching that I think is so valuable to the outcome and as well as to our business. So we can't forget that.
No, absolutely.
Yeah.
Absolutely. And like I said in the presentation, what's good for the patients is good for us.
Absolutely.
And it goes around that way. If you can provide good value to your patients, then they're going to be happy and happier, and they're going to spread the word more about your clinic and what you're doing. So, the training that we do offer does include a lot of these compliance protocols,
right,
as well, the science-based and proven protocols, as well as some of the back-end stuff that, most of us as busy professionals don't have time to work on, like an e-store and a web presence and a patient inquiry generator and things like that. It really saves all of that effort and energy if you choose to employ that part of our programs in your own practice. It's kind of like we've done all the hard work for you already.
Yeah. So, no, I think that's a really good point.
We try to make it easy for you.
Well, that's the challenge that we all have is implementation.
The guesswork, really.
Yeah, and Jill's done a great job with PRP
sure.
Science with providing marketing materials and just sort of jumpstart. When you come to my trainings, you get some very, very helpful forms, patient forms and questionnaires, and just all those nitty gritty things. I know Hair Check is excellent in that regard, and your team and my team continue to try to make that
shout out to Andres.
easier.
You have your Jill, and I have my Andres. So Andres Gonzalez, I'm sure would appreciate that that shout out. That he's really the man behind the method when it comes to executing the hair coach program and the training that we do offer in that regard. And he has taken it to another level since its inception. So all of that hard work, as an MBA, he's put that together and done that hard work for you.
Well, I love this kind of collaboration, both clinically as well as from a business and implementation perspective. I think we all win together when we concentrate on taking the best care of patients, and when we pool our resources, so to speak, and share the knowledge, and whether it's marketing ideas or all of the clinical information that you've given us tonight. So I really thank you very, very much. And please check out the handouts. We'll be sending an email out with a recording of the seminar, or the webinar rather, I'm sorry. So please feel free to look again, and it'll be posted on join.studioprp.com. So thank you very much for joining us. Thanks, Dr. Bauman.
Well, thank you, Dr. Roy. Really do appreciate the invitation tonight. And speaking of sharing, if you're out there on social media,
Yes.
Connect with us. If you'd like to give us some feedback about the program or that you'd like to hear about in future events, either on Dr. Roy's side or from Bauman Medical, just let us know. We're out there, whether it be LinkedIn, Twitter, Facebook. I also got Instagram and everything else that's YouTube out the wazoo. So, give us a shout out there, and we'll take a look at your stuff as well. And so I think it's important for all of us who are in the field of PRP and taking care of patients to move things forward in the public eye as well. So we're happy to help you do that.
Excellent. We'll keep doing this every month, bringing some good information to you. And if you have any suggestions as to what it is that you'd like to hear in some of these webinars, please let us know, and we'll try to do our best to make that happen for you. All right. Good night then. Thank you very much.
Thanks, Dr. Roy.